Hi, and welcome to another episode of What's Up, Doc, a health and wellness show dedicated to guiding you, our audience, through the world of medicine and healthcare to help you live healthier and better lives. My name is Dr. Alia Albarwani, and I'm a board-certified family physician. My show, What's Up, Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can find us on Samsung 19, Apple TV, Roku TV, and Fire TV. You can also find us streaming live almost every day on our YouTube page at youtube.com/Muslim Network TV and on our website, muslimnetwork.tv. Today we have a really exciting episode, and we're going to be talking about all things acne. Especially nowadays with us wearing masks, acne has become a bigger problem than before. Joining us in that discussion is Dr. Gloria Nguyen. She's a board-certified dermatologist. She attended college at Stanford University, where she studied human biology. Dr. Nguyen later went to New York to receive her medical degree at Albert Einstein College of Medicine in 2011. She then completed a skin cancer research fellowship at the University of Alabama, Birmingham, before going on to complete her dermatology residency training at the University of Michigan in Ann Arbor. Dr. Nguyen eventually returned home to the Bay Area, where she served on faculty in the Stanford Department of Dermatology before joining Kaiser Permanente in 2018. Welcome, Dr. Nguyen. Hi.
Hi, thank you for having me.
Absolutely. So, as I started in the beginning, I started this episode by saying that maskne is a big problem, or acne as a result of wearing masks. So why don't we start there and talk about what it is, what causes it, and how can we avoid this?
Great question, and definitely relevant to the times that we're living in right now. So this new term, maskne, kind of evolved from the fact that a lot of us are wearing masks for many, many hours at a time, 8 hours, 12 hours a day. And it's causing a lot of people to break out with acne underneath their mask, hence maskne.
So it tends to generally be kind of in this area that we're seeing that. Okay.
Exactly. Yes. So a lot of my patients come in saying, my acne is so much worse, especially in the lower face, because I'm wearing these masks all day. What can I do to decrease, these breakouts? And I think there are a few pretty simple tricks that I usually have for decreasing maskne. One would be that I recommend that individuals wash their face with a mild, gentle, fragrance-free cleanser like CeraVe or Cetaphil prior to putting on the mask. And usually when you're washing your face, you can just use warm water. You don't need to use super hot water because that will actually dry out your skin more. Apply the cleanser, rinse it off, and then kind of just pat your face dry with a soft towel.
Okay, so things that we can easily access at a drugstore, CeraVe, or you had mentioned CeraVe. I've also heard Cetaphil is a good gentle cleanser. Would you recommend that one as well?
Yeah, I think they're both great brands, either CeraVe or Cetaphil. There's other ones as well. In general, you just want to pick something that is mild, that is fragrance-free.
Okay. And of course, this is not a sponsored video by any means. These are just products that Dr. Nguyen has experience with and recommends to her patients. Just want to put that out there. So when acne evolves in this area, is that usually as a result of the same thing that causes acne elsewhere, or is it particularly aggressive or a particular form as a result of rubbing or wear and tear? What kinds of things should we be aware of? Because a lot of us are wearing maybe makeup underneath these masks, and we're wearing it, like you had mentioned, for such long hours. Is taking a break a good idea? Maybe not wearing makeup underneath our mask. What if you can explain a little bit about why this happens and how we can also avoid it as far as things that we're doing in our daily life?
Yeah, so, there's certain things about wearing a mask that can exacerbate acne formation. One thing is that I usually recommend not wearing makeup underneath your mask. That will actually end up kind of clogging your pores. Okay. Okay.
Okay.
So that's important. Another thing is that the mask does kind of cause friction and rubbing and irritation on the skin. Sometimes you're hot, you're sweating underneath. That kind of further irritates the skin. So after washing your face, I usually recommend applying a light moisturizer on top of the skin. The moisturizing lotion will do two things. It will hydrate the skin, and it will also act as a barrier to prevent the mask, the friction from the mask rubbing against the skin and irritating it even more.
Will sunscreen work as a good alternative, or maybe on top of the moisturizer? I know how important sunscreen is. Will that do the same thing to form that barrier that you just mentioned?
Yes, if it's there's many different types of products available. Some of them are moisturizing lotions with sunscreen or SPF built into it. So if that is the case, then that works. And, nowadays, the mask itself is already protecting our lower face from the sun. So you don't necessarily have to wear sunscreen where the mask.
Good point.
But on the upper part of your face, that's still unprotected. So I do recommend either a hat or sunscreen, at least on the exposed part of the face.
That's a really good point. I still wear sunscreen all over my face, and I do get particularly sweaty here underneath the mask. Mm-hmm. So that's some really good advice to not need to wear it underneath my mask because of that physical barrier. It didn't even occur to me. So let's take a step back now and talk more generally about acne. A lot of people think that acne is a result of dirty skin, so they scrub harder or they wash harder to try and get their skin cleaner. Some people think it's a result of things that they're eating. Why don't you go through with us what actually causes acne in the other parts of our face and how it comes to be?
That's a great question, and one that I get all the time. So the causes of acne are multifactorial, meaning that there are many different potential causes. Part of it is genetic. So sometimes, really bad, severe acne can run in families. Not something that you necessarily have control over. Part of it is how active the oil glands are in the skin. Mm-hmm. Also not something that we have immediate control over. Part of it is also due to bacteria that lives on the skin and promotes acne. So that's why sometimes using over-the-counter antibacterial washes, such as benzoyl peroxide, will help counteract that. And then certainly part of it is hormonal as well. This is why acne is so much worse usually during the teenage years, because, all those hormone changes are definitely affecting the skin. But for many people, and especially women, that acne can even continue into adulthood as well.
That's a great point. Those are some great points. It's really important, as you mentioned, because it's multifactorial. I didn't mean to interrupt you there, but because it's multifactorial, to determine where you are or what might be causing it. And not everybody who has acne has the same kind of acne or the same reason behind their acne. That's a great point.
Yeah. Some common myths that I've heard about acne, it's caused by food is one. The studies, diet is not as strongly tied to acne as people probably like to believe. Certainly we like to think that, the things that cause these are under our control and diet is under our control. But, there's only been a few studies done looking at the connection of diet to acne. And those studies have found that a diet high in sugary and sweet foods, or foods that have a high glycemic index, tend to make acne worse. And that's probably because sugar is kind of a pro-inflammatory substance, and it spikes the insulin level in your body. And insulin is also pro-inflammatory, so that can promote inflammation in the skin. The other studies have shown that a diet high in dairy products, or dairy milk-based products can also lead to increased or worse acne. So if a patient wants to try to modify their diet in order to help clear up their skin, I usually suggest that they could try cutting out, kind of the sweet and sugary types of foods, junk food, and then maybe cutting out some dairy as well, if that's a large component of what they eat.
Those are some really great tips. I know personally, I have noticed the difference when I have dairy and I don't have dairy. And when I was younger, I would have sworn that nuts also have something to do with it. But I understand that the evidence is not conclusive that it can, that there's a direct link to acne. But would you, as you mentioned with dairy, would you say, well, if you notice a relationship to X that you're eating, then avoid it and just move on with it? Is that
what? I mean, everybody's different. Everybody's diet is different. Everybody's body responds differently to different types of foods. So if you are noticing in particular that there's one thing that always makes your acne breakout worse, it's probably worth it to try to minimize or avoid that. So even if it's not necessarily evidence-based, a lot of these are anecdotal, but, I'll have patients coming in saying like, "Well, every time I eat chocolate, it makes my face so much worse," or, that sort of thing.
Absolutely. I think that there's a lot of power in how patients perceive things. And if they're telling you this is what I think, a lot of times you can't really convince them otherwise if they've made up their minds. And so you kind of have to step back and be like, well, if as long as it's not harmful, of course, as long as you see a relationship, just avoid it and let's see what happens.
Yeah.
The other thing that I noticed is I've heard a lot of questions from my patients as well, is as far as hand touching your face. With COVID, of course, that is something we try to recommend not doing anyway, and maybe people's acne have gotten better as a result of that. But what is your impression as far as putting your hands on your face? Is that something that we should avoid? Is that something that we can stop worrying about? Does it really lead to acne?
I would say that this is probably one of the myths about acne. It probably does not contribute to acne to a significant degree. That being said, I do think that probably avoiding touching your face is a good idea because we touch everything in our environment with our hands. So we are potentially transferring, irritating substances from the environment to our face that can potentially irritate the skin or even cause, skin allergies. The other thing is that people who are prone to breakouts, they like to kind of squeeze their pimples because
or put toothpaste on it,
or they think they're getting rid of the pimple. Okay, that's another reason they're touching their face, is they think they're trying to kind of squeeze these little blackheads and whiteheads. I definitely have to always counsel patients, try not to squeeze your acne, try not to pick at your pimples. In general, this can do more harm than good, because it's potentially pushing that inflammation that's in the skin deeper and increasing the risk of scarring down the road. So if you have acne, see your dermatologist, get some treatments, prescribe treatments to treat it, but don't try to pop your pimples.
Absolutely. Don't be like the pimple popper doctor. That needs to be done under very strictly controlled circumstances in a very sterile environment. So that's a really good point. So far we've touched on a few things that can help people with their acne. And you mentioned some benzoyl peroxide over the counter that they can easily get. If they do have some maskne, using a gentle wash like Cetaphil or CeraVe, and a moisturizer as well to create a barrier. You mentioned myths, and I want to pick up on one more myth one more thing that may or may not be a myth, and that is sleeping in your makeup. For a lot of women, that is something after a long day we tend to do because we just get tired or lazy, whatever it is. And so does that affect our skin and cause us to have breakouts?
I do believe that it's not a good idea to sleep in your makeup if you can help it. You know, we always have those days where, you know, it's a super long day and you kind of just forget to wash your face before going to bed. But for the same reason that I said, avoid wearing makeup underneath your mask because it clogs your pores. That's the same reason that you probably should not be wearing makeup to bed either, because that is also going to lead to clogging of the pores. And it also kind of, if you're not washing your face or washing the makeup off, you also have more oil from the day that is just kind of sitting on top of the skin. And that oil is not great for acne either.
Okay, that's a really important thing to remember.
Yeah.
A lot of us don't think that it's that bad of a thing to do, and we just kind of forget to do it, or we're not very good about removing everything completely. So that's great information.
Yeah. So if you can cleanse your face at least twice a day, once in the morning and then once in the evening after your day is done, and you can kind of remove all that makeup, that's usually sufficient for most people of all different skin types.
Great. Now, I know that with acne, there are different kinds of acne, and you mentioned a few products that I recapped earlier. Are there specific types of acne that you may not want to use over-the-counter products, and maybe you want to make sure that you do see your doctor first before starting something over-the-counter?
So most of the over-the-counter products like retinols, vitamin A creams, and different types of anti-acne washes such as benzoyl peroxide or salicylic acid are in general considered pretty mild. So I usually don't see a lot of problems with people trying these over-the-counter products first, because they're not that strong in terms of being prescription strength. So I don't think it hurts to try these things first, and if it's not controlling your acne sufficiently, then at that point, you should seek a consultation or treatment with a dermatologist. One thing I will say is that all topical acne treatments do have a drying effect on the skin. It does cause increased skin dryness and potentially skin irritation. Again, the prescription products will cause more irritation than the over-the-counter products can. But if you start using these types of anti-acne treatments, it's even more important to also include a moisturizer as part of your routine to help kind of offset some of that skin irritation and dryness.
That's a great point. A lot of the times we think that, or I know that personally, I suffered from acne a lot when I was a teenager. And I was told that using some products that irritation was normal and that I should keep pushing, and there's going to be an ugly phase before you have clear skin. And so I had made that mistake and continued to use something that was irritating to my skin in spite of my skin telling me to stop. And so that's a really good point that you bring up, is that these they're medicated products. Even though they are over the counter, it's important to understand they are medicated. And if you do experience irritation, it's important to either slow down or stop, depending on how severe it is. And then making sure you're keeping your skin moisturized as well. Those are some great points.
Yeah, always listen to your body. And your body will tell you what it can or cannot tolerate. If you're starting to notice too much irritation, there's a few kind of little tips that I can recommend. So, for example, with the benzoyl peroxide wash, which is an over-the-counter antibacterial wash for acne, if that's too irritating, instead of using the full 10%, I recommend buying online a lower percentage, like 3% or 4%. It's going to be less irritating, but it's going to be just equally as effective as the full 10%. And then there's an over-the-counter vitamin A cream, and we can talk about retinols and vitamin A creams and what role they play in acne later. But you can develop tolerance to them over time, meaning that the irritation is worse in the beginning when you first use it. And then as you continue to use it, your skin, your body kind of adapts to that, and the irritation becomes less and less. So you can kind of space it out, like maybe do it every third night and then gradually increase it to every second night and then eventually use it every night.
That's really useful information. I'm glad that we are on the same page, that irritation is not expected for everything, and that there are ways to get around any irritation that you might experience. So thanks for that information so far, Dr. Nguyen. For now, we're going to take a quick break, and we'll be back after a few minutes.
Sounds great. Thank you.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Oh, no. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! 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 Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV.
Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available. now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously.
It's an investment in our future.
To finish, let me tell you,
There are new scripts of my new mission, and it is something that I enjoy talking about. My new mission is space. Houston, we do not have a problem. Salam, see you soon. Me too.
Welcome back to What's Up Doc and Muslim Network TV. And before the break, we were talking with Dr. Gloria Nguyen about the different medications that can cause irritation. We covered benzoyl peroxide and some retinol just briefly. So I wanted to jump into the use of retinol. And you mentioned vitamin A products, etc. So as we mentioned, there are different medications for different kinds of acne. Would you say that Retin-A is used for a different kind of acne, or would you use it for the same things that you would use benzoyl peroxide for?
So when we say retinol, or the prescription equivalent is Retin-A cream or tretinoin cream, we are referring to this group of medications or products that are based on vitamin A. So they're all derived from vitamin A. And retinols are considered one of the cornerstones of acne treatment. Without a retinoid on board, it's very hard to get acne under better control. And what they basically do is they help unclog the pores in your skin. You can almost think of them as Drano for the skin.
I like that. Okay, Drano.
The other thing is that they decrease oil production in the skin. Hence, that's why they tend to have this kind of drying effect as a potential side effect. And they are especially good at targeting blackheads and whiteheads, which are the earliest versions, the earliest lesions of acne.
Okay. Now, as far as I mentioned different kinds of acne, can you touch on that a little bit? We haven't really talked about that. I know that you mentioned blackheads and whiteheads, but for people who have more severe acne, like cystic acne, that's all over the face, what would you recommend for people who have a more serious type of acne?
So that's a great question. In general, we kind of divide acne into two different types. One is what is called comedonal acne, meaning that the person usually gets what are called comedones, which is the medical term to describe blackheads and whiteheads. And those are kind of more of the smaller kind of skin-colored bumps that people may notice, often in the T-zone. And then the other type of acne that people can get is what we call inflammatory acne, which is where we get kind of these big, red, inflamed, painful, angry pimples. And most people actually end up having both types of acne. So when you have predominantly comedonal acne, or the blackheads and whiteheads, optimizing the topical regimen in terms of having a Retin-A retinoid cream on board is really important, because, as I said, the vitamin A cream kind of helps unclogs these pores and targets the blackheads and whiteheads. But when people start to have more of the inflammatory type of acne, or even the most severe form of inflammatory acne, which is what we call nodulocystic acne, where they get these deep-seated, painful cystic lesions that are just really difficult to deal with and can lead to, unfortunately, a lot of scarring later on. In those cases, topicals may not be sufficient, and we often need to add an oral pill in order to control the acne and control that inflammation from the inside out rather than just from the outside in. So that can include, for example, oral antibiotic pills or even a medicine like Accutane.
Accutane has a really bad rap. I remember when Accutane was really popular back many years ago, and everyone was using it. And then there were a lot of bad reactions people had, side effects, things like that. And nowadays, I don't know how often it's being used, but maybe you can clear up some misunderstandings that we might have about using Accutane. I know that a lot of people who want to use it, they are hesitant because of the known side effects, such as liver issues, extreme irritation that can happen. And sometimes I understand that you have to do multiple rounds of Accutane in order to see improvement. Can you speak a little bit about that and what has been your experience with patients, and how do you allay some of their fears?
Sure. So Accutane is one of the best treatments that we have for acne. It's gotten a little bit of a bad rep, unfortunately, but it is actually transformative. For somebody with severe acne who is an appropriate candidate, it can really change their life. It is really, the thing that you want to use for the most severe forms of acne, meaning that patients who have what we call nodulocystic acne, that deep, painful, red cystic type of acne, or patients who may start at risk of developing scarring, would be good candidates. And it's also kind of used as the treatment of last resort, because it does have more side effects than most other acne treatments. So if a patient has tried and failed topical treatments and other oral treatments like antibiotic pills, then at that point, we start talking about the option of Accutane. So, like I said, Accutane has gotten a bad rep in the past, and some of it centers around the fact that it can cause mood changes and depression. This is really more common in patients who have an underlying history of depression prior to treatment. And the studies now, the most recent studies that have been done looking at depression and Accutane treatment actually have found that there's a confounding factor, because most patients who need a treatment like Accutane have the most severe forms of acne, and that in turn also affects their self-esteem. So that cohort of severe acne patients already has an increased risk of depression and anxiety, and part of that can be due to the fact that their acne is so bad it affects their self-image. So if you take that confounding factor out, the link between Accutane causing depression is actually not probably insignificant.
That's
and if
really
anything, it decreases depression because it helps people feel better about their skin,
seeing their skin improve. That's a really good point. And I want to talk about that social aspect of acne. And for a lot of people with really bad, as you mentioned, the nodulocystic, the very painful, kind of aggressive acne, so to speak, that can affect people's ability to interact with others socially. It can give them low self-esteem because they feel like they don't look like themselves, that their skin is, it's a condition. And so they feel as though this is something that they should be hiding away from. And as you mentioned, can cause and lead to depression. Can you talk to us a little bit about some of that, as far as seeing your patients come in, maybe a story of someone who came in with really bad acne and how they transform, and how your experience as their clinician, as their provider, just seeing that change, or if you do see that change often in your patients with acne?
Yeah, I have so many stories of patients whose lives have been changed by, either Accutane or other treatments. And, for example, I had a girl who came in who was in her teen years. She's probably like in 8th grade or 9th grade. She just had, the most severe form of acne, nodular cystic, and she had already developed scarring, unfortunately, at such a young age. And she came in with her mom, and she was just, really quiet, didn't really look at me. And, her mom said that she just felt really devastated by how bad her skin looked. Wow. She, felt self-conscious. She didn't want to, she didn't have a lot of friends at school because she felt that people were making fun of her because of, how bad her face looked. And then we got her started on treatment. And after about 6 months of treatment, the vast majority of her acne improved. And, when I saw her at the end of treatment, she was just a totally different person, just happy and smiling. And her mom was telling me that she was so much more outgoing at school and just doing so much better in terms of academics. So especially for young adolescents who, peer judgment and popularity is very dependent. Sometimes, unfortunately, they're kind of dependent on these kind of superficial things. It can really affect a teenager's sense of who they are before they've had a chance to become an adult and really find out who their true selves are. So I think I really believe in treating patients early and getting the acne under better control to not only help with their self-esteem, but also to prevent scarring, because once scarring has developed, unfortunately, that is very, very difficult to treat and in some cases considered semi-permanent.
Absolutely. That's really good advice, Dr. Nguyen. So coming in to get your acne looked at and treated early is definitely an important thing to prevent long-term effects such as scarring. In the cases where you do see patients further along where scarring has developed or started to develop, you mentioned retinol creams or vitamin A derivatives as something that can help to resurface the skin. What other things do you recommend to help with acne scarring, or procedures maybe in the office that you can offer for patients who have scarring that has developed?
So first of all, I just wanted to clarify what scarring actually refers to. A true acne scar is an actual divot or depression in the skin, or a texture change in the skin as a result of uncontrolled acne. Many times people will mistake dark spots, discoloration, or redness left over from prior acne as quote unquote scarring, but that is not actually true scarring. That discoloration or extra pigment that's left over from old acne, which is especially more common in patients with darker skin types, that is temporary and it does fade with time, but it may take many months. But
I'm glad that you clarified that, because I do have patients come in and want to describe exactly what you said, discoloration or increased redness, or maybe even a slight texture change in their skin where they had majority of their acne as scarring. So thank you for clarifying that.
Of course. And then for true acne scars, which are, as I described, these kind of divots or depressions in the skin, there's different cosmetic procedures that can be considered, including different types of laser treatments, chemical peels, to name a few. Using a vitamin A or retinol cream can also slightly improve the texture of the skin as well, because it increases collagen production in the skin. So if used consistently long-term, sometimes that can improve skin texture as well.
Okay. You mentioned peels. Are you referring to peels that we can easily get from different brand names over the counter, or would you recommend something more? Would you recommend peels only under the supervision of a physician?
Yeah. So the peels that are available over the counter are very light. They, they're okay for kind of, if you have kind of a little bit of discolored skin, or you kind of just want to smooth out your skin a little bit. But if we're talking about true acne scarring, that type of scar, in order to improve the appearance of that requires usually more high percentage types of acid peels. And that should only be done in a doctor's office under the supervision of a trained physician.
Absolutely. I'm glad you clarified that. I think a lot of times we like to play chemist, and because acne, there's so much information on the internet about acne and different opinions, and they're not always necessarily somebody who's trained, such as yourself. They may be estheticians, which they're trained in their own way, but as you mentioned, there are a lot of intricacies about treating acne that is really important to make sure you're seeing somebody who can also deal with the complications that come from these different treatments. So seeing a dermatologist is definitely important. Exactly. I want to go back a little bit and talk about when you mentioned social impact on the teenager that you mentioned, the story that you shared with us. Now, of course, there is a lot of pressure for teenagers to look and be in a certain way, and that can, of course, impact their self-esteem and how they interact with other people. You know, arguably, as an adult, we expect not to have to deal with it anymore. And so I want to touch a little bit about adult acne, because I do think that because in society, you know, socially, we think that acne is something that you get when you're a teenager. And so I want to talk a little bit about the impact on adults and what can be done as a result of having, you know, what can be done about adult acne.
Yeah, so, you know, for some teenagers, you know, they get this explosion of acne during their during puberty, and then as they kind of get older into their 20s and 30s, it gets better, and those are the lucky ones. Mm-hmm. But adult acne is actually also extremely common, and for many people, the acne that started in adolescence continues into adulthood, I see this especially, it can affect both men and women, but women in particular, when they have adult acne in their young adult women in their 20s or 30s, it often has a strong hormonal influence to it. And often this type of hormonal acne presents as acne that is on the lower face, so on the chin and jawline and lower cheeks. And oftentimes these women will report that their acne always flares or gets worse right before their menstrual period or during their menstrual period. So those are usually some key indications that there is this very strong hormonal influence leading to these breakouts.
That's a really good point. So you said chin, jawline, and just basically the lower part here. So that's a good point. I know that there are I've heard a little bit about acne mapping. And so I don't know if you have heard of that, but that, you know, different parts of your face, if you have a breakout in different parts of your face, they may be related to something different. But that's really good to know that if you're seeing it in that area, it might be a clue as if you're a female that it may be related to your hormones.
Right. So when I see that distribution of acne, I mean, they can still get acne in other parts of their face and body, certainly. Okay. But it's usually, they always say it's the worst on their lower face. And that usually indicates that there's a strong hormonal component. And for those, if it's a woman with hormonal acne, there are two treatments that can be considered. One is combined birth control pills. And these can be helpful for regulating their periods and also kind of controlling those hormonal outbreaks. Another is a pill called spironolactone that was originally used as a blood pressure medication, but has now developed a sort of secondary use for treating hormonal acne because it tends to oppose the quote-unquote androgens or male hormones in the body that can promote acne.
That's really helpful. So for women, for adults, and particularly women who may have hormonal acne, it's especially important to check in with your doctor, your dermatologist, because these medications you mentioned, birth control as well as spironolactone, of course, those are not over the counter. So it's important to make sure that you are seeing someone so that they can make sure that you are the appropriate candidate, first of all. And then there is some monitoring, I would imagine, being on these medications that's involved. And so it's important to speak with your physician.
Yes, these treatments, while they are effective, they do have, you know, their own kind of potential side effects. So you would want to seek a doctor's advice before starting any of those.
Perfect. Perfect. So before we continue our conversation, let's take a quick break. You're watching What's Up Doc on Muslim Network TV, and we'll be right back.
My wife, who she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, you know, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it, and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Assalamu alaikum.
Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe, and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Welcome back to What's Up Doc on Muslim Network TV. Before the break, we were talking with Dr. Gloria Nguyen about adult hormonal acne and the importance of talking to your provider to get a prescription for treatment. So Dr. Nguyen, I want to talk a little bit about treating people of color. You alluded earlier to how sometimes that discoloration or darkening or sometimes redness that can happen with people who have pigment in their skin, a little bit darker melanated skin, whatever you like to call it, that they can have a different or some longer term effects like discoloration that can happen after acne. Let's talk a little bit about that and how you treat that, if you treat it differently from people who are not darker, who are lighter or not melanated.
So, my practice is here based in the Bay Area, and we have a very diverse population in the greater San Francisco region, including individuals of all different types of ethnicities and backgrounds. And that's part of, one of the things that I love about practicing in this area. But I do get a lot of questions about skin discoloration. And so patients who have a darker skin type or a darker skin tone, they have more pigment in their skin at baseline. So as a result, anytime that they have something that causes inflammation in their skin, and that includes acne, the body tends to react by leaving behind extra pigment in the skin. And this is what we often refer to as post-inflammatory hyperpigmentation. Mm-hmm. And it's kind of these discolored dark marks that even after the initial acne pimple has, gone away, these dark marks are very frustrating. They can last for many months. Fortunately, most of the time these are temporary, but the darker your skin tone is, the longer these dark marks can often stick around. And there's a couple tricks that I use to kind of help decrease this discoloration. One is to really encourage people to use their retinol cream or their prescription Retin-A cream consistently, because that controls not only their active acne, but it also actually helps lighten some of these dark spots. So Retin-A is actually going to help decrease that hyperpigmentation and get rid of it more quickly. There are also other types of prescription topical medications, such as azelaic acid, or Finacea is the brand name, that can also be prescribed by your doctor. This also treats acne, but is also great for helping to lighten these dark spots a little bit more quickly. And then in some cases, there are even bleaching creams or lightening creams like hydroquinone that can also be used to lighten the dark spots a little bit quicker. Mm-hmm. I believe that 2% hydroquinone is available over the counter, but for stronger prescription strength 4%, you really do need to see your doctor because it can have some potential side effects. Okay. And then the last thing I would mention is that wearing sunscreen, especially in people who tend to get this hyperpigmentation, is really important, because if they're going outside and exposing their skin to the sun unprotected, that will tan the skin and cause those dark marks to remain for much longer than they need to.
Great points. So things that we need to just remember with respect to people with darker skin is keeping, maybe I would add actually to, just taking what you said earlier as far as like picking or touching the pimple, and that can cause hyperpigmentation, scarring, etc. So keep your hands off. Think about using something like continue to use some retinoids or retinol products that you mentioned, making sure that you talk to your doctor if you wanted something prescription like azelaic acid, and also making sure to keep wearing sunscreen no matter what you're doing. And some over-the-counter product would be hydroquinone if needed. And I would also add to that, as a person of color who has used hydroquinone, is to make sure you put it only on the spot that you have the hyperpigmentation.
Yes.
And being very careful about applying it with maybe a Q-tip and right on the spot. Otherwise, you have this weird you have further discoloration because you have a lighter spot and there's a gradient. Would you agree?
That's a great point. Yes. You always, especially with a bleaching cream like hydroquinone, you want to be careful only to put it on the dark spot that you want treated. If you put it anywhere else, including normal or unaffected skin, you will get accidental lightening of those other areas of skin. So be careful with those types of products.
Exactly. Before we wrap up, I want to talk about acne on the rest of your body and particularly on your back. And let's just briefly discuss if we would use the same kind of products that we've been discussing all along, or if there's something else that we would use. I know we did not talk about salicylic acid, but if you could also talk about if that has a role in any of the things that we've talked about, or in the application to treat acne on your back or other parts of the body.
Sure. So acne on the trunk or acne on the back, what we call backne, is very common as well. And I usually start with a topical regimen of an over-the-counter wash, anti-acne wash, such as benzoyl peroxide wash in the shower, or alternatively, as you mentioned, you can also use salicylic acid wash, which is another common anti-acne wash that is available. For example, Neutrogena makes one that is quite popular among my patients. Salicylic acid is good for acne too. It kind of helps kind of blackheads and whiteheads, and it kind of helps exfoliate the skin. So it can also be helpful for acne. I would say that it's not quite as effective as benzoyl peroxide wash if you wanted to compare the two over-the-counter washes. So I usually say, if you like using salicylic acid and it's helping with your acne, go ahead and continue it, but also consider just adding a benzoyl peroxide wash once in a while as well. And you can alternate them every other day or a couple of times a week. And then other things that I recommend for trunk acne is I'll add, for example, a topical solution such as clindamycin solution to help with kind of those more big red.
How do you get that back there? How do you expect your patients to apply that?
So, if you have a partner, you can recruit them to help you apply it. I have patients who are really creative, like they use like a spatula from the kitchen, or they get like this special cream applicator from Bed Bath & Beyond.
With the sponge on it, the one with the sponge, is it like kind of like a back scratcher, but with the sponge on the end?
Yeah. So something like that. So you can get creative. But of course, with such a large surface area and a difficult to reach location, it can be difficult to control really bad acne on the body with just topicals alone. So, if the over-the-counter topicals are not working, it's usually time to see a doctor. And I end up often having to prescribe some sort of oral treatment for these patients to, if the acne is severe, in order to get under control. Usually they require some sort of oral antibiotic for a few months.
Okay.
Or Accutane even.
Absolutely. I was wondering about that. Okay.
Yeah.
Well, thank you so much, Dr. Nguyen. We have discussed quite a bit. We talked about acne on the face, on the trunk, and people of color, hormonal acne, when to use Accutane, when to see your dermatologist. I think that hopefully we provided a lot of useful information to our audience today. And we thank you again for joining us here today. We wish you every success in your career.
It was my pleasure, and thank you so much for having me. And happy holidays.
Thank you, and to you as well. So thank you for joining us on another episode of What's Up, Doc. You can watch all of our episodes on YouTube, on our YouTube page at youtube.com/Muslim Network TV, or our website, muslimnetwork.tv. I'm your host, Dr. Alia Albarwani, and we were discussing all things acne today with Dr. Gloria Nguyen. You can watch us on all of those streaming platforms that I just went over, and I will see you guys next time on our next episode of What's Up, Doc.